Hello everyone. As we are celebrating the breastfeeding week, so today is the second day of breastfeeding week. Today I am going to explain what is the physiology of lactation. To understand the physiology of lactation, we have to remember what are the structures are there in the breast tissue. So outside it is the nipple. This part is the areola, dark brown color, and these are the Montgomery glands, and these milk gland and the duct combinedly known as alveoli, and the muscle cells surrounding the milk gland, these are the myoepithelial cell, and these three part muscle cell, milk glands and the ducts combinedly make the mammary tissue, and there is a supportive connective tissue and the fat present, and the blood vessels, lymphatic vessels and nerve supply all are making the breast tissue. So mammary tissue, alveoli plus this muscle cell, myoepithelial cell. So in the alveoli, these milk gland plus milk ducts both are present. These are the milk gland. These small are the milk secreting cell where the milk is secreted, and this is the duct. And whenever between feeds, milk collects in the lumen of the alveoli and duct. So here milk is collected in the lumen of alveoli and in this duct. And when baby suck, then these myoepithelial cell, muscle cell contract and milk is flowing through the duct and ejected out. So in the physiology of lactation, milk glands, lobules also the other name for this, in alveoli produce the milk, and milk duct that transport the milk from the milk gland to the nipple. Each milk duct widened to form the sac. Here in this image you can see this is the alveoli, this is milk duct, and when this milk duct is dilated and forming the lactiferous sinus, and during the lactation these milk glands produce the milk which is transferred through the duct to the sac. Then through the nipple pore milk is ejected out. What are the breastfeeding reflexes in the mother? Prolactin reflex, also known as milk producing reflex, nipple erection reflex, and oxytocin reflex, also known as milk ejection reflex. Prolactin helps in milk production. So whenever baby suckle, sensory nerve ending in the nipple are stimulated, and these nerve ending are stimulated and impulse goes to the hypothalamus and the pituitary, anterior pituitary. Then anterior pituitary secrete the prolactin into the blood, and prolactin in blood then stimulate the milk secreting cells and production of the milk occur. And prolactin level is highest 30 minutes after starting the breastfeeding, and also more in the night times. That's why it is a concept that more feeding during the night time stimulate more milk production and baby will get the adequate breast milk. So always we have to promote the nighttime breastfeeding. Prolactin levels increases whenever there is early initiation of the breastfeeding. So as early as possible, baby should get the first breastfeed within half to 1 hour of the normal delivery or within 4 hours as early as possible after LSCS. More the baby suck, it will stimulate the nipple and more prolactin secretion will occur. More breastfeeding at the night time, again prolactin release will increase. Long the baby suck, so at least 20 minutes babies should suck and baby should get the complete milk, foremilk and hind milk. Strongly and well the baby is attached at the breast. So I will tell you the details of good attachment in one of my video. Prolactin levels decreases whenever there is delayed initiation of breastfeed. Prelactal feeds means the other than breast milk, other feeds are given to the baby, making the baby wait for the feeds. Again, prolactin release will be decreased whenever they are giving the dummy, specifier or bottle feed. prolactin secretion will decrease. And in painful breast condition, prolactin secretion decreases. What are the benefits of the prolactin reflex to the mother? Mother feel sleepy and relaxed whenever prolactin is secreted. And also it helps in the spacing of the birth. So prolactin basically suppresses the release of gonadotropin releasing hormone, FSH and LH hormone. So ultimately it suppresses the ovulation. So help in spacing of the birth. Oxytocin reflex, also known as letdown or milk ejection reflex. Here in this image you can see whenever baby is sucking, the sensory nerve ending in the nipple are stimulated and impulse goes to the hypothalamus and posterior pituitary. And posterior pituitary release the oxytocin hormone in the blood, and this hormone act on the myoepithelial cell which surround the alveoli, duct and sinus. So with the contraction of the myoepithelial cell or muscle cell, milk is squeezed from the alveoli to the duct to the sinus then toward the nipple and milk is ejected out. That's why this reflex is known as milk ejection reflex. Oxytocin work before and during breastfeeding, while the prolactin work half hour after giving the breastfeeding. So milk is produced for the next feed by the prolactin reflex, and by oxytocin reflex, milk is ejected at the time of breastfeeding. Oxytocin level increases whenever mother is having the loving thought of the baby, touching, smelling and seeing her baby with the sound of the baby. And if mother is confident, happy and relaxed, then this reflex is stimulated and level of the oxytocin will be increased. Whenever mother is having the anxiety, worry or stress, then oxytocin level decreases. This reflex is suppressed. If mother is having the severe pain, uncomfortable, again this reflex will decrease. And whenever mother is not having any family support, having the separation, not happy, lack of confidence or doubts, this reflex will be suppressed and level of oxytocin will be decreased. So during the breastfeeding time in first 6 months after the delivery, family members should take care that the mother should be happy, relaxed, confident. What are the benefits of the oxytocin to the mother? Oxytocin enhances the feeling of affection between the mother and the child. So it promotes the bonding between the mother and the baby. Mother also feel relaxed with this reflex, and also by this reflex uterine muscles contract immediately after delivery. So chances of bleeding and PPH also reduces with the help of this reflex. What are the factors which affect the mother's reflexes? Acute inhibition of the reflexes can occur by the anger, sudden shock or strong pain because it releases the adrenaline, and vasoconstriction of vessels surrounding the alveoli occur. It will lead to the oxytocin does not reach to the myoepithelial cell. No contraction of the alveoli occur, no ejection occur, and mother feels as drying up. Milk is dried and milk will not be produced and ejected out. What are the breastfeeding reflexes in the baby? Rooting, sucking and swallowing reflex. So here in this image you can see rooting reflex, sucking reflex, swallowing reflex all are important for the effective breastfeeding. Rooting reflex, also known as surge reflex, appear around the 28 to 30 weeks of gestational age. When the mother's nipple touches the baby's cheek or lip, this reflex is stimulated. Baby turns in the direction of the nipple and open the mouth and putting the tongue down and forward. And to understand and to elicit this reflex, in rooting reflex, we have to keep our finger over the cheek near the mouth, and in response to this, baby will turn the face toward the finger and open the mouth also. This reflex is also known as search reflex. This reflex helps in the baby to get the breastfeeding, to localize the nipple. And this reflex appear between 28 to 30 weeks of gestational age and disappear by the 4 months of age. Rarely it persists beyond 12 months. This reflex normally present between 28 weeks to till 4 months of age. If it is not present, that means baby is having the CNS depression, any neurological disorder. If this reflex persists after 12 months, that means baby is having the hypersensitivity around the lips and mouth, or baby may be developing the any social, speech or learning problems and difficulty with the solid foods, and baby can become the messy eater or dribbling. These kind of problems can be there whenever this reflex persists beyond 12 months. For sucking reflex, here in this image and in this video you can see either examiner just keep the finger in the mouth and finger is touching the palate of the baby's mouth, or when baby is taking the breastfeeding, then breast nipple is touching the palate of the baby's mouth. It stimulates the sucking reflex and baby is having the strong rapid sucking movement of the mouth. This reflex appear between 32 to 34 weeks of gestational age and fully mature by 34 to 36 weeks and disappear by 3 months of age. Rarely persist beyond 1 year. After 3 months of age, the sucking of the baby is result of the conscious effort. No longer it is a reflex. And before 3 months, it is the sucking reflex. Just touching the palate, baby will start the sucking movements. While after 3 months, baby is doing the sucking by the conscious efforts. As the brain is mature, this reflex is disappearing. And before 34 weeks of gestation age, in preterm baby, this reflex is not very coordinated with the uh, swallowing, and it is not easy to give the breastfeeding in less than 34 weeks of gestational age. So coordinated sucking swallowing reflex appear between 34 to 36 weeks, and by that time we can give the breastfeeding very easily. This is also known as sucking, swallowing and breathing sequence, which is mature by the 34 weeks of gestational age. Sucking reflex is the most essential reflex for the successful lactation. And by sucking reflex, babies suck at the nipple and areola, which is placed in the mouth. Mouth around the nipple and areola form the effective seal, creating the negative pressure. And when baby squeeze the underlying sinus by compressing and stretching the nipple between the tongue and palate, then only the milk will be ejected. So for effective sucking, not only the nipple part but also the areola part should also be in the baby mouth. So good attachment is required for the sucking reflex. Here in this image you can see this is the bad attachment. So if the baby suck only at the nipple, milk is not ejected. Baby does not get the sufficient milk and suck more vigorously, resulting in sore nipple can also occur. So always for the sucking reflex we have to keep in mind that all the signs of good attachment we have to explain. Now last is the swallowing reflex. When the baby's mouth fill with the milk by the sucking reflex, baby swallow the milk. It is known as swallowing reflex. This reflex develops earlier than the sucking reflex. So the baby who can suck effectively at the breast will always be able to swallow the milk. Coordination of the sucking, swallowing and breathing appear between 32 to 34 weeks of gestational age and fully develop by the 34 weeks of gestational age. So this is all about the physiology of lactation. Thank you so much.